The Home Health Quality Improvement National Campaign welcomes you to How to Quit Smoking. This video is part of a series talking about different ways you can work with your healthcare team to reduce your risk for having a heart attack or stroke. We're glad you're interested in or are thinking about quitting smoking. In this video, we'll talk about the harmful effects of tobacco on your body, including your heart. The important point is that it is never too late to stop. Your body will begin to get better right away. Do you know that there are more former smokers today than current smokers? Quitting may not be easy, but if you are determined, you can do it. You do not need to do this alone. It is important to have people helping you, including your family and friends, but also your healthcare team. Your nurse, therapists, or doctor can provide you with information and resources about quitting. Your healthcare team is here to encourage and help you. Are you interested in quitting but afraid that you won't be able to do it alone? Your nurse and doctor are there to help you. It's important to be honest with the number of cigarettes you smoke per day with your healthcare team. Do you really know how many you smoke a day? The nurse can give you a tobacco use log worksheet to track the number of cigarettes you really smoke in a day and how important each cigarette is to you. The Planning for Change Thinking About Quitting worksheet can help you begin to make a plan to quit. This worksheet can help you look at the top reasons you may be still smoking, why it is important to quit, and to help identify why it was hard to quit before if you've ever tried to quit before. This worksheet helps you to set up a plan to quit, identify your triggers for smoking, and how to deal with the triggers. The worksheet also helps you to identify your support systems like family and friends and has an 800 number to call for support or other things that might help. It's also important to think about the counseling and medication assistance that would be helpful. Studies show that more people are able to quit successfully with both counseling support and medications. Counseling support can be with your nurse or doctor during appointments, over the phone, or in a support group. Counseling includes ideas to deal with your triggers or cravings, withdrawal symptoms, or any other issues you may have. As a smoker, your body is addicted to the nicotine in the tobacco. When you stop smoking, you're likely to have some withdrawal symptoms. Your nurse can share a handout that tells about withdrawal symptoms. The handout has the causes for the symptoms, how long the symptoms might last, and most importantly, it gives you tips to help relieve the symptoms. Hunger is one of the withdrawal symptoms that people worry about. If they stop smoking, they fear they will gain a lot of weight. Prepare for the hunger symptoms. Nurses may recommend to have plenty of water or low-calorie drinks and snacks available. This will help decrease the chance of weight gain. Counseling provides encouragement for the quit date goal and during the process of quitting, as well as for the disappointments and restarts. Even having a toll-free number to call for support day and night is very helpful. An example of one is 1-800-QUIT-NOW. Medications help a lot with quitting and should be discussed with your doctor or nurse. What types of medications can help to quit smoking? Nicotine replacement therapy is one of the first drugs used by many smokers to quit. It helps to reduce the cravings when the body is going through nicotine withdrawal by giving a controlled dose of nicotine. The medication comes in gum, patches, lozenges, nasal sprays, and inhalers. The dose is reduced slowly to help with withdrawal symptoms. For example, you may start with a piece of gum every 1 to 2 hours when awake for a few weeks. Then the amount of gum is reduced for several weeks and reduced again. Your body is able to slowly reduce the amount of nicotine with the gum while you're not smoking. When using patches, they're changed every day and the dose is lowered after a number of weeks and reduced again after another few weeks. Talk with your doctor and nurse about nicotine replacement therapy. Ask about the advantages, disadvantages, and possible side effects for each type of nicotine replacement to find what might work best for you. Also, talk with the doctor if you've had a recent heart attack, heart irregularities, or have chest pain to find out if the nicotine replacement would be a good choice for you. There are other types of medications that can help with quitting smoking. These medications help with withdrawal effects or block the effects of nicotine on the body. Usually, these medications are started before quitting and then continue for about 12 weeks. Talk with your doctor and nurse about the advantages, disadvantages, and possible side effects of these medications to find what might work best for you. Make sure to watch the video Smoking and Your Heart to learn more about how smoking affects your heart and blood vessels. It is important to know quitting smoking begins to improve your heart's health almost right away. It actually doesn't take long to see the benefits of quitting smoking. Less than 30 minutes after you quit smoking, the blood pressure and pulse go back to normal. Within 8 hours, the carbon monoxide goes back to normal. Then you have more oxygen getting to all the cells in your body. The chances of a heart attack decreases in just 24 hours. Make sure you heard that fact clearly. After the first day of quitting smoking, the heart attack risk decreases. The nicotine in tobacco causes damage to nerve endings. In 48 hours, those damaged nerve endings begin to regrow, which improves your sense of smell and taste. In 72 hours, breathing gets easier and the lungs expand more fully. This allows for more oxygen getting to the blood and heart. Between 2 and 12 weeks, lung function increases 30% and circulation improves. The 1-year mark finds the risk for coronary heart disease is half that of a smoker. The next two facts are amazing. After quitting for 3 years, heart attack risk is similar to that of a person who has never smoked. Only after 3 years of being smoke-free, your risk of having a heart attack is like that of someone who has never smoked. Somewhere between 5 and 15 years, stroke risk becomes similar to a person who has never smoked. Hopefully this information helps to encourage you as you're thinking about or are getting ready to quit. The benefits of quitting begin right away. Thank you for watching How to Quit Smoking. We hope that you've learned more about the need to consider quitting. Talk with your healthcare team about your interest in quitting and how to get more information and help on how to quit smoking. Also, there are other videos in this series you can watch. Remember, quitting smoking is one of the best things you can do for yourself and your family.